Hi, my name is Vijay Patel with Advanced Physical Medicine, and today I'm going to show you how I treat and manage or assess and manage lumbar stenosis. A patient with this diagnosis typically presents with symptoms such as weakness in the lower extremities, difficulty ambulating any significant distance. They have difficulty shopping, or even in some cases walking from their car to the store or even into your clinic. These patients have these symptoms often for several years, progressively getting worse. Other symptoms or other findings for patients who suffer from lumbar stenosis is that they frequently report that their discomfort immediately subsides upon sitting down. And this enables them to, they typically rest for a few minutes, and this enables them to get up and stand and walk for an additional 5 or 10 minutes. But typically these patients present with negative findings on orthopedic tests, but the objective findings that I do find to be pretty consistent is these patients tend to have weakness in the lower extremities, often having difficulty performing a heel or toe walk. They tend to have poor coordination, balance, and lower extremity strength. They tend to have atrophy of a lot of the musculature in their lower extremities. Other common muscle imbalances that I find with these patients are tightness in the hip flexors, mildly antalgic position. It could be to the left or right, or often it's just straight central. The differential diagnoses for these conditions would be lumbar disc or discopathy, or maybe even compression fracture, spondylolisthesis. Once I've established a diagnosis, here's what a typical treatment looks like. Our goal is typically to help improve flexibility in the lower extremities. We look to lengthen the hip flexor musculature. Sometimes we may do some modified Thomas stretching. We'll do some passive hamstring stretching, as well as exercises to help improve lower extremity strength, which would include the chair squat, heel and toe raises. We may address foot dysfunction if they have any with orthotic devices, preferably a UCBL shell if they are severely overpronated with any genu valgus. As far as chiropractic manipulations involved, we do use very simple chiropractic adjusting techniques using either diversified, flexion distraction, or even Thompson drop, whichever the patient finds most comfortable, particularly if the patient is required to move or turn or rotate on the adjusting table. I'm going to demonstrate some of my favorite exercises for these patients. Very simple and easy to do. We start with just some passive hamstring stretches. Raise the patient's leg up gently and place it slightly over my shoulder here, and then just raise up to the patient's tolerance. I hold for 30 seconds and lower. Another favorite exercise that I like to perform on patients who suffer from lumbar stenosis is the modified Thomas stretch. It's a wonderful passive stretch for the individual to help open up the hip flexors so that they go from an antalgic position to a more erect position, thereby reducing some of the strain on the lower back muscles as well as the glutes and the hamstrings. When doing this stretch, we do one side at a time. We ask the patient to sit off the edge of a table, and then we ask the patient to grab one leg, pull the knee up into the chest, and they lay back onto their flat onto their back, and you'll notice that when the hip flexor is very tight, the thigh will not rest flat on the table. So typically what I do is I just lean into the flexed knee and very gently press down on the leg that is straight, thereby stretching out the hip flexor musculature. Care plan frequency can range anywhere from 2 to 3 times per week. We typically see significant improvement in the patients, after which we reevaluate their lumbar spine range of motion, as well as ask them about distances that they can walk, how far can they walk, or how long can they walk with or without assistance, comparing it to previous questionnaires. Other exercises I like for the patients to do at home would be the chair squat. I had mentioned that before, where a patient would stand in front of either a chair or a table, and they would just stand and sit repeatedly, thereby strengthening muscles in the lower extremity, glutes, as well as the hamstring and lower back. Some exercises I teach the patients are hip flexor stretches, either very much like the ones that you see on Chiro Up, protocols for lower back pain, and that's the hip flexor stretch. You tell the patient where they should be feeling the stretch up here. They shouldn't be feeling any stress in the lower back. Other exercises include the hamstring stretch, supine hamstring stretch. I usually have them use a belt. Other instruction I give individuals is also how to get in and out of recumbent positions. I find that when they get in and out of a recumbent position directly from a supine position, they're at increased risk of injuring their back or increasing lower back pain. But if they get up very much like the way you saw me get up and also get down the same way, that helps reduce the wear and tear on the lower back joints. Home advice for these individuals, often these patients are reluctant to use the walker because that's why they're in to see you, because they want to get rid of it. But I do find them to be more successful at improving their stamina when they do have the walker, because they can walk much farther without the fear of having to look for a place to sit down. If they have a walker with the chair built in, they can sit and they can continue walking in further radiuses away from their home, their cars. Thank you very much for watching, and I hope you've learned something about this diagnosis, and I'm really hoping to be able to contribute in the future. Other things that I utilize to help patients get over their lumbar stenosis conditions is I show them this certificate of excellence. I tell them how excellent I am in treating lumbar stenosis, and I expect them to get better, and if they don't get better, it's their problem, not really mine, because I have this.